Hi, this is Richard Chamberlain, and welcome back to the Protecting Your Family's Future podcast. Today, we're going to be talking about the difference between Medicare and Medicaid. Now, this subject comes up because sometimes people will talk to us about long-term care issues, and they say, well, I have Medicare. Won't Medicare pay my long-term care costs? So we have to talk about the difference between Medicare and Medicaid, and we're going to cover that today in this podcast. Now, if you are familiar at all with Medicare, you know that it is a health insurance program run by the federal government, and it's available for people who are age 65 or over, or for people who have certain disabilities. Now, Medicare covers healthcare needs generally, like hospitalizations, doctor visits, medication, diagnostic testing, surgeries, things like that. But it will not cover long-term care expenses. A couple of weeks ago, we talked about what long-term care is. If you don't know, go back and listen to that episode from 2 weeks ago. Now, Medicaid, on the other hand, is a needs-based government program that covers all healthcare needs, including long-term care, if someone qualifies for that program. Next week, we're going to be looking at what are the qualification criteria for Medicaid, but for now, just know that Medicaid will provide benefits if a person meets an income test and an asset test. So what does Medicare cover with regard to long-term care? Because it does cover some care in a nursing home. Basically, Medicare, the health insurance, will cover up to 20 days of a long-term care stay. It can cover up to 100 days if a person is improving. If the patient is receiving medical care and their condition is improving, Medicare will pay for up to 100 days. But as soon as that person stops improving, and this is according to their healthcare provider, their doctor, they stop improving, the care becomes what's called custodial, then Medicare will stop paying, even if only 25 days have occurred, or 45 days. They don't cover 100 days period. They cover up to 100 days if a person is continuously improving. Medicaid, on the other hand, will pay for that long-term care. Even when Medicare stops, they pay for that custodial care. Again, as long as a person meets those minimum requirements for asset and income. So I hope that that's helpful for you in kind of understanding, number one, that Medicare will not pay for long-term care expenses on a long-term basis. Medicaid is the government program that will do that. And as we continue this discussion in the coming weeks, we'll look at how does somebody qualify for Medicaid and how do we plan around those things. So I hope this has been helpful for you, and we'll see you next time. Thanks.